Laya Healthcare, looking after you always. Proud sponsors of Real Health with Karl Henry.
Hello and welcome to Real Health with me, Karl Henry, in association with Laya Healthcare. It's something I think we'd all like a bit more of, but building self-esteem and maintaining it can seem like a massive, massive challenge. This week, I'm delighted to be joined by clinical psychologist Dr. Eddie Murphy and friend to talk to us about self-confidence and how we can accept who we are. Eddie, a very big welcome back to the show.
Thanks very much. It's lovely to be here again, Karl.
So how's life?
Well, life is good. We're coming to the end of Operation Transformation. Looking forward to doing the 5K run. But for me, as you know, it's always about the inner transformation. And these concepts that we're going to discuss today around self-esteem, self-confidence, self-acceptance, they're all like first cousins. So I think we'll try and unpack them a little bit and give listeners an opportunity to maybe to walk away with some tools that they can use. That's the goal towards the end of the talk. Big concepts now, Karl. I really appreciate very psychologically minded this week, I have to say.
We try to be. I always get kind of scared when you come into the studio because Eddie has this way of looking at you, and he's looking into you, and whatever content we're going to discuss, it's like you're having a personal consultation with him. Are self-esteem and self-confidence the same thing? That's the first question I have for you.
No, so they're like first cousins. They're related, but they're not the same thing. Okay, so if you take self-confidence, that's your belief in your abilities. Now, that changes over time. So if you think about it, when you first started being a podcast host, where would you rate your self-confidence about being a podcast host?
See, this is what he does. He asks you these questions.
Put you under pressure.
5.
Karl.
There we go. 5.
5 out of
10.
Okay, so you're 50%.
Yeah.
And now because you've moved from novice to expert, you're an expert, you've done hundreds of podcast hosting, where would you rate yourself now?
8.
Okay, I'd say you're being a little bit unkind to yourself, okay? I think you're probably second guessing there. You can't say a 9, but of course you want to leave room for improvement because you always strive. But self-confidence and self around is that ability in your capacity, in your abilities. That's what self-confidence is. And that can shift, okay? Self-esteem, and I'd say if we can spend a little more time on self-esteem because it's a more complex, it's about your self-worth, how a person sees themselves. And that's very different, okay? So if you can imagine, and when I work clinically with patients or when I'm working with individuals, it's that self-esteem is something. If you actually think about it, if you look at it around self-confidence, where do people start when they're doing a couch to 5K?
Oh yeah, okay. So start out of 10, 2.
Yeah, okay. And then, but after towards the end,
they're 8, 9, 10.
So you see, practice, turning up, showing up, learning stuff, following others can really improve our self-confidence.
Okay, so you can grow your self-confidence from a low base to a higher base, and you grow it by working at the same thing, continuously working at something and gaining. You gain confidence by working at it.
Yeah, that's it. And working with others and maybe having a coach or having someone to assist you, getting positive feedback can be a really powerful way. So that but self-esteem is very different. Now, if you imagine, Karl, a boat, a trawler going out to sea, okay? And you see this, and in fair weather, the trawler goes out to sea and it's going through and it's lovely and it's sort of at one with nature. Does that make sense? And then a big storm comes up and you still have this trawler and it's struggling to keep going out at sea. Now imagine you then realised that there was an anchor underneath this trawler and it's dragging all the time it's out there. You weren't aware of it. So that's a little bit like where your self-esteem is. Because in good weather, having low self-esteem can hold you back. And in times of struggle, it can be even more difficult having this. So that thing about it, self-esteem is our inner belief about ourselves. I am unworthy. I am unlovable. And they're generally negative beliefs that we have about ourselves. Often formed through our early life experiences, through either neglectful or absence or not getting a positive reinforcement. And maybe another way to think about this is if you think of a tree that's in a garden and it's a walled garden and it just gets enough water and sunlight and fertilizer and it grows, but it's not. But imagine In another space, a tree gets water, nutrients, praise, encouragement, support. So this is what helped really powerful in terms of supporting ourselves when it comes to our self-esteem, our ability, what we see ourselves and our self-worth, not judged on what others are, but judged on what we see our worth is. So I think it's one of the most powerful things that, from a human perspective, we need to work on. What feeds into our self-esteem quite often is our early relationships. So attachments, and there's different styles of attachments. So we can have a healthy attachment, we can have an unhealthy attachment, or we can have a very distant attachment. It's actually 4 styles of attachment, but let's just focus on the self-esteem bit. So, and one of the things I want to just flag for some people, so often I'd ask, maybe someone comes to you with really low self-esteem, and if they might say they had depression and might be aware, we tease out the self-esteem bit, and I'd say, how long have you been depressed for? And they might say, oh, I've been depressed all my life or for the last 30 or 40 years. Well, when I hear that, a trigger goes up in my head going, I don't know, I'm not overly convinced this is a depression. I think this is around low self-esteem. And low self-esteem is where a person has their inner voice is toxic, it's corrosive, it's punitive, it's critical, it's very unhelpful. So, for example, a new opportunity might arise and the person might go, I'm not good at that. I'm not going to put my hand up there for that. I'm not even going to try that. And so many people, whether it's around maybe low confidence and self-esteem, I can think of people who may have talked themselves out of jobs or work or opportunities because in their head they say, oh, I'm not ready for that. Now, sometimes I would say, go for it. Jump into the situation. Learn the mastery over time and work on that negative voice, that really, that continuous negative voice that impacts on our self-esteem.
And tell me about kind of low self-esteem. Where does it come from? So is it something that's formed over the course of your early years? Can it happen later in life?
Generally speaking, it's the early influences that a child would have. So, for example, if you compare a person who grew up in a warm, nurturing environment versus somebody that grew up in a harsh, critical environment where perfectionism was the only standard, where maybe there was bullying experiences, where people are, maybe they didn't achieve so well in different areas. Like everybody can't achieve in different areas. But generally it's where parenting is either absent, critical, harsh, where maybe opportunities haven't been had. So they're sort of areas where can feed into our low self-esteem. And then the belief is that I'm not good enough. See, it's all about the belief. Think about it like a tree. Cut the tree, you look at the rings in the tree. Self-belief, the core belief is, what is that core belief that's going on there? So the core belief is I'm not good enough, I'm attractive enough, I'm not worthy enough, it's generally a negative. And when we're working on self-esteem, it takes just a longer way to understand self-esteem, because we have thoughts, these thoughts, I'm not good enough, I'm not worthy enough, these are the thoughts, and feed into this belief that I'm not good enough, nobody would want me. So therefore then our actions in the world reflect that. So we may not take up these opportunities that I've talked about because we just don't have that. What would be linked to that then is our low self-confidence. It's first cousin.
Okay, so should we be saying to people who are listening in, sit down and write out your core beliefs, and get them to look at that and say, what are my core beliefs? That am I good enough? Am I fit enough? Am I healthy enough? Am I attractive enough? Or whatever they may be. Is that a good way for people who are listening in to start trying to understand their self-esteem, their self-beliefs, and by just asking the question, what are your core beliefs?
Yeah, I think it's a great one, because by understanding what our beliefs are, and maybe you can rate them as well, because that's the interesting bit. If you start rating them 0 to 100, how true do I believe this about myself? Then you can start changing. And you see, if you have Carl, if you have a negative belief about yourself, okay? Now, I sort of see it like an old-fashioned like radio with a volume switch. And if you have a negative belief, that volume switch can be quite high, and it's sort of drumming in this toxic narrative. But that's only a belief. Now, we would say beliefs and thoughts and are not facts. So it's just the way we look at the world. So if we can also then have alternative beliefs, that the opposite of a negative belief, and they're the ones that we can start working on. So how do we do that? Is we can look at writing it down and finding successful times in our life, looking at things like, so we start layering things like, I make good friendships, I'm a good communicator, I was positive in that situation, I faced adversity there in that situation. And so we start banking our successes, because what happens is sometimes we filter out and we discount our successes. And if we start accruing our successes and looking at them, not in a boastful way, but in a way that sort of says, you know what, there's something going on in my life that I'm okay. It's okay to be okay, and at times it's okay not to be okay, as the phrase would go. And it can fluctuate. So then having that, working on self-esteem, I think can be really powerful stuff, really helpful.
Folks, you're listening to Real Health with me, Karl Henry, in association with Laya Healthcare. We're having a fascinating chat about self-belief, self-esteem, core beliefs, self-confidence. So we've chatted about the self-confidence bit and how that you can improve that by kind of just turning up and practice and all of that, and the core beliefs concept. What about the likes of social media and how that impacts on our self-esteem and our beliefs? Because we talk about it with a lot of our guests every time they come in, which is that, how do you handle negative criticism on social media? We went through that last year as a collective, where we got a lot of negative kind of, trolling on social media. And that's difficult to handle because it does impact your esteem, and it does make you second guess things.
It makes you second, so it was difficult. I suppose the most difficult part was when our professional bodies were tagged into it. Because one thing about challenging the individual, there's another thing about challenging the individual and threatening their livelihood. That becomes very different. But social media, I suppose what I would say is about compare and despair, right? This is a big thing where individuals may be comparing themselves to the curated life that somebody's put up there. And you see, I suppose the real issue is that we have to see the individual beyond just the image. And I know we're going to probably we'll link in a little bit to self-image here now. But the person is, what's their values? What type of, because for example, if you work with self-image, for example, there's individuals who have their self-image concept is formed. Then they might have acquired a disability or a burns or had a mastectomy or had an amputation. So their self-image changes. Now, in psychology, because we work with individuals who've been through these struggles, we sort of study and look at self-image over time. And I know it's sort of shifting a little bit from the media bit, but you're more than just the image of yourself. People with high self-image and self-concept and beliefs about themselves see themselves with they don't actually focus on one particular point, because everybody has a point in their body that they probably don't like. That's quite normal, actually.
Mine is my big toe. I hate my big toe.
Yeah.
On both feet. Yeah.
On both feet.
I hate my feet.
Okay.
Yeah, can't handle it at all. I just don't like my feet.
Oh, yeah.
Then here, there we go. Random fact.
There you go. Random fact. Karl Henry doesn't like these. Well, you see, if they bothered you, right?
Yeah.
So let's say, for example, it's when you don't like something and it impacts on you in a social way. For example, if you decided you were going to the beach, but you'd never get into the water because you'd never expose your toes.
Yes. Yeah.
Then that becomes a problem.
Yeah.
So then then it's worth doing the intervention. But so we got to see ourselves beyond. Like when you see a person, you connect with. Now, I was thinking about this earlier on today, and I was saying, who would you like to go for a meal with? Now, I'm asking your listeners, who would you really like to go for a meal with? And have a sit down and have a meal with. It's often asked about people. And when you think about that, you can think about it for a minute, but when you think about that, it's not the person's that has an image that necessarily you're going to go. It's someone that you find interesting, someone that you find maybe has faced adversity and overcome it, someone that you might get a life lesson from, someone that has had such a breadth of experience. It's not about, we don't say, oh, I'm going to have a meal with that person because they're beautiful looking or whatever.
Lots of people would.
Yeah, they maybe would, but lots of people wouldn't, because they might go beyond just the facade
Yeah.
and go into what is it about that person? What do they represent? And so they're therefore they're the type of when we look at self image, we've got to get out just beyond the image and look at, and that's what people with high self image, they see themselves in lots of different ways. They see themselves as happy, attractive, positive, engaging with other people, and people from all diversity, all backgrounds have a way. This is open to everybody how we look at our self-image, and it's actually culturally it's can different as well. So if we're in different cultures, it can happen differently about how we view our self-image.
And does this pull back to that concept of looking in the mirror and being able to say to yourself, not that you love yourself, but you're happy with what you see with the reflection in the mirror? Is that a very basic way of testing that kind of sense of self-image? Because lots of people struggle with that idea.
Yeah, well, you see, if people will look in the mirror and see it and might pick out their faults or might pick out their unhappiness. But what I'm inviting individuals to think about, people to say is that you're more than what you see in that reflective image. That's the core point, that you're way more than just the reflective image. And remember, that reflective image changes over a life course. So how do we learn to love our bodies? How do we learn? So we start appreciating, and we can start thinking about different things. I appreciate my body because it breathes, it beats, it gets me, thankfully I can walk around or I can run. And you start appreciating the body beyond the image. You start appreciating the body in terms of how it allows you form relationships, how it brings you to, you have intellect and you've skills, you're able to maybe go out and work, you're able to contribute to your community, you're able to focus on. See, I think, Karl, and you'll have to bring me back another day, but it's about, right, when it comes to life and living, it's about fulfillment, possibility, finding a life that is finding a life where our possibilities, our beliefs, and fulfillment, and how we can find that. And that's a different psychological journey.
Okay, so that whole idea of self-acceptance and helping to get yourself towards accepting yourself, is it, from what you're saying there, starting with the positives? So it's starting with, I respect my body for being able to get me into work every day. I respect my body for being able to go for a run. I like my little finger, or is it starting with the things that you like to overcome the things that you don't like, or is that me being over pedantic?
Okay, no, but self-image and self-acceptance is huge, because people who struggle with this then might have a condition called body dysmorphia, sort of separate conversation. But having self-acceptance, imagine in life struggling not to accept ourselves, because we only get one of these beautiful lives. And we're struggling, and we're sort of going around with this corrosive belief that I'm not good enough, I'm not worthy enough. So we need to start in a nice way, in a gentle way, because in a compassionate way towards ourselves, that we develop compassion towards ourselves. And a good tool to do this is, what would you imagine you had a belief that you weren't self-accepting yourself, and you said it out loud to your friends, say, I really don't like myself. What would you say to that friend, or what would a friend say to you? And you find a friend say, oh my God, I can't believe you're really saying that, because this is what I think about you. I think you're amazing. I think you're warm. I think you're a person I can come to, I can share my worries with. There's so many things that you contribute to my life. And sometimes we need to be open to that, So that's how by questioning ourselves, what would I say to my friend if they said this to me? And our response to that is how we need to talk to ourselves. That's the core to it. How we talk to ourselves. Are we talking to ourselves in a critical, negative, punitive way? Or are we talking to ourselves in a coaching, nurturant, compassionate way?
Okay, so we've covered lots of ground and lots of different different things.
Yeah.
If I was to ask you for your top tips for what people should take away from the episode, or how to start addressing their own self-confidence or self-esteem, what would your 3 or 5 takeaways be? That's a horrible question. I know it's a horrible question. But it's a nice question, because it brings people towards the end and say, okay, look, what, off the back of listening to this conversation, what really should I do?
Okay, so I always find it interesting that people want to reduce complexity,
Always.
and that's fine. I get it, right? I do get it. But of the three cousins, self-acceptance, self-confidence, and self-esteem, self-esteem is the most important. And you can build from there the self-acceptance, which I'd probably say is second most important.
But
You
can not that you can overcome your self-esteem, but you can push yourself through having. So, for example,
So overcoming, like, actually, it's really
you can push through it. Is my point.
Okay,
Or can you?
well, now there's a really good book, and the evidence-based intervention for self-esteem is by Melanie Fennell, and it's called Overcoming Self-Esteem. That's the classic cognitive behavioral therapy book and it's the classic model that psychologists use when it comes to working with individuals with low self-esteem.
Yeah.
And that's available in all public libraries. And the research base behind it, what we're talking about today in terms of self-esteem. So going back to your I just missed your question.
You pulled right back out of that one.
I was trying to think of it. Here, I'm going. You asked
What I
me
was
three
gonna-
questions, which
Oh,
I
did you?
hate doing, and
But
then
what-
then you asked me another question.
What I was going to say to you was that, the self-esteem piece.
Yeah.
So my angle on that, on a personal level, would be the sink or swim model, right? Which is that if I believe I can't do something, I'll generally just jump in and try and sing and do it anyway and see if I sink or swim.
Okay, well, see,
Which explains my mental psychology.
Okay, but this is what we call really black and white thinking. Okay, because it's sort of you use the word you can push through on it, right? So
Or can you?
okay,
No.
well, hold it now. So slow it down. So pushing through, see, it's not a great concept because if you think of the tree, right? So if you were in the garden with the wall garden, didn't just get the nurturance, just got enough water and stuff, it depends because for some people, not everybody has the same starting point. That's what I'm getting at, right?
Yeah.
So pushing through is not an option for everybody.
Agreed.
Okay? So it depends on where you're starting from.
It depends on the
Some people start with more vulnerability.
Yeah.
And so it's not an all or nothing or push through thing. It's a thing to work on, become aware of, and see it on a continuum rather than a light switch on and off. I either have self-esteem or I don't have it. That we all have some self-esteem, and it can be a lovely journey of trying to enhance our self-esteem. And it's not because that's a good thing, because when we start believing in ourselves in a more confident way, that I am able, I can try new things, I can go for this. So I'd invite your listeners to think about a T-shirt, and it goes, I am ... and they can fill it in. And for some, they might put I am, and it could be a negative label. I am confused, or I'm upset, I'm sad, I'm fearful, I'm afraid, I'm unlovable. And I'd invite them then to flip the T-shirt into I am capable, I am okay, I am lovable, I am happy, I am positive, I am optimistic at times of challenge. And they're the sort of areas that we can really sort of go for and work on.
Okay, so it's about looking at your beliefs, seeing what they are, and then trying to bring them to a more positive space and work on those over the course of time.
That'll do me, Karl.
You like that?
Yeah, I like it. I like
Dr. Eddie Murphy, it's lovely to have you back in again. Much appreciated for coming in. Folks, I really hope you enjoyed that chat on today's episode of Real Health with me, Karl Henry, in association with Laya Healthcare. If you want to follow Dr. Eddie Murphy on Instagram, he is
at Dr. Eddie Murphy, and on Twitter as well.
And his book is Becoming Your Real Self, and that's out in all good bookstores as well. Dr. Eddie Murphy, it is great to catch up. We'll see you very, very soon. Folks, that is it for another episode of Real Health with me, Karl Henry, in association with Laya Healthcare. You know where we are, at Karl Henry PT on Instagram. We don't do Twitter anymore because they're all very cranky over there. And realhealth@independent.ie for any emails you want to send through. Don't forget to rate and review, and we'll see you next week for more Real Health. So long ago.
Laya Healthcare, looking after you always. Proud sponsors of Real Health with Karl Henry.